This is WFYI News Now. It's July 30th, and I'm Abriana Heron. On today's show, a new policy at IPS that will change discipline practices in school. Funding to train Haitian and Burmese residents to become behavioral health professionals. The Indianapolis Public Library expands its program that gives students access to more than 1 million books, resources, and databases. And it's been nearly 1 year since Indiana's near-total abortion ban took effect.
We are all bracing to kind of see the data that we anticipate we will see in a state with an abortion ban.
Those stories coming up, but first. The Indiana Arts Commission is awarding more than $3.5 million to groups across the state to support long-term operations and specific projects. The commission said it has worked to reduce barriers for organizations to apply and received a record number of applications for the project's grant program. About 400 nonprofit organizations will receive money from the commission. In Marion County, 60 groups were awarded altogether, about a fifth of the total grant money handed out. Grantees included the Kurt Vonnegut Museum and Library, the Indiana Repertory Theater, and the Phoenix Theater. And the Indianapolis Public School Board approved a new policy that will alter schools' discipline practices. From WFYI's Education Desk, Sydney Dauphiné reports the district is taking a less punitive approach.
The Indianapolis Public School Board voted on a resolution to implement restorative justice to the district's disciplinary policy. This includes plans for mediation sessions, community service, and formal meetings between families, students, and staff. Staff members will be trained on restorative justice practices and how to implement it into existing discipline policies. The district has been tracking suspension rates in recent years in an effort to focus more on rehabilitation and reducing recidivism. The number of suspensions decreased by nearly 65% between 2016 and 2023 academic years. I'm Sydney Dauphiné.
Some Haitian and Burmese residents struggle to access mental health care due to stigma and a lack of translation services. Side Effects Public Media's Elizabeth Gabriel reports on new funding that will train Haitian and Burmese residents to become behavioral health professionals in their communities.
The new $50,000 initiative is funded through the Behavioral Health Cultural Equity Grants. It was announced by the Office of Public Health and Safety, Mental Health America of Indiana, and leaders from Indianapolis's Haitian and Burmese communities. Justin Beatty is with Mental Health America of Indiana. He says 20 participants will receive credentials in behavioral health while also providing workforce development.
Everyone that we train and certify will have an employable skill that they can actually make a living wage at to provide in their communities.
Leaders from the Haitian and Burmese communities will host community forums to learn more about people's mental health needs. Elizabeth Gabriel, Side Effects Public Media.
4,000 more students in Marion County will get access to the Indianapolis Public Library without leaving their school. The Indianapolis Public Library is expanding its shared system to 8 IPS schools this fall. The system is a network of library collections from branches and over 70 schools in Indianapolis. Students have access to digital and physical copies from more than 2 million books, resources, and databases. Sarah Batt is the manager of the Shared System program. She says no single school library in the area can meet the needs of all of its students.
By sharing materials among many schools and among the library branches, they're better able to meet their students' academic needs.
Batt says more accessibility to different types of books can help students with reading comprehension and the science of reading.
That's what we really need right now, is for kids to be reading more so that they can develop the skill of focusing on what they're reading.
The Shared System Network includes resources from 5 library specialties, including Riley Children's Hospital and the Indianapolis Museum of Art. And for our final story today, it's been nearly 1 year since Indiana's near-total abortion ban took effect, limiting access to care to just a few narrow exceptions. Indiana Public Broadcasting's Abigail Ruman reports it will take some time for data to better reflect the impact the law has had on Hoosiers.
Indiana already has some of the worst infant and maternal mortality rates in the country. However, some researchers are concerned that the number of deaths and complications will increase under the near-total ban. Tracy Wilkinson is a professor of obstetrics and gynecology at the Indiana University School of Medicine. She says part of the reason for Indiana's high mortality rates is the state already had abortion care restrictions before the ban went into effect. Wilkinson said it will take some time for the data to reflect how the near-total ban may change those rates.
We are all bracing to kind of see the data that we anticipate we will see in a state with an abortion ban.
Wilkinson says some states already have more data to show the full effect of an abortion ban. An abortion ban in Texas, for example, negatively affected several public health data points, such as mortality and congenital syphilis rates. For Indiana Public Broadcasting, I'm Abigail Ruman.
And that's all for today's episode of WFYI News Now. Our podcast is produced by Drew Dodlin with support from the news team at WFYI and public media journalists across the state. Our news director is Sarah Neal Estes. Kendall Antron produced our music, and I'm your host, Abriana Herron. If you like today's episode, remember to subscribe and share. And follow WFYI on Instagram, Facebook, and YouTube to check in on our newsroom throughout the day. Thanks for listening. We'll be back tomorrow.